For consent to be ethically valid, a decision must be voluntary. Voluntariness means that a patient's choice is made freely, without coercion, manipulation, or undue pressure. Even when a patient is informed and capable, autonomy is undermined if the surrounding conditions effectively force the decision. Coercion is the most obvious threat to voluntariness. When a patient is threatened with harm, loss of care, or negative consequences for refusing treatment, the decision ceases to be free. In such cases, what appears to be consent is better understood as compliance under pressure. Ethical healthcare rejects coercion because it treats patients as instruments rather than moral agents. More difficult to identify, however, are subtle forms of influence that compromise voluntariness without overt force. Family coercion is one such influence. Families often provide support and guidance, and their involvement does not automatically violate autonomy. However, when emotional pressure, cultural expectations, or fear of relational consequences drive a patient's decision, voluntariness becomes ethically fragile. A patient who consents primarily to avoid disappointing family members, causing conflict, or being perceived as selfish may not be acting freely, even if they verbally agree. Institutional pressure can also erode voluntariness. Healthcare environments are structured around authority, efficiency, and protocols. Patients may feel compelled to consent because they assume clinicians know best, fear being labeled uncooperative, or believe refusal will result in poor treatment. Time constraints, rushed explanations, and implicit expectations to comply can transform consent into acquiescence rather than genuine authorization. Economic vulnerability presents a particularly serious challenge to voluntariness. Patients facing financial hardship, lack of insurance, unstable housing, or employment insecurity may feel they have no real choice. Decisions made under such conditions may reflect necessity rather than preference. When survival pressures shape consent, autonomy is ethically compromised even if no individual intends to coerce. Respecting voluntariness therefore requires more than avoiding overt pressure. It requires attentiveness to power imbalances, dependency, and vulnerability within the clinical encounter. Clinicians have an ethical responsibility to create conditions in which patients feel free to decline, question, or delay decisions without fear of punishment, abandonment, or judgment. Voluntariness does not require the absence of influence altogether. Advice, recommendations, and shared decision-making are compatible with autonomy when they are offered transparently and without manipulation. What matters ethically is whether the patient retains meaningful control over the decision. In this sense, voluntariness protects the moral core of autonomy. It ensures that consent reflects a patient's own values and priorities rather than the pressures of circumstance. Without voluntariness, informed consent becomes a procedural formality rather than an expression of genuine self-determination.